Hello, good morning, good afternoon, good evening, everyone. My name is Sandeep Sharma. I'm a technology analyst at IDC, and it's a pleasure to be with all of you today this morning. First of all, let me mention that the conversation that we are going to have today does not have any bearing with whatever work I do at IDC. And moreover, this is completely non-commercial. We are doing this mostly for the benefit of business school students in India and globally. This is more of an information dissemination session. We want to help the society through different conversations. And on that note, today it is my pleasure and privilege to welcome one of my technology industry colleagues at IDC, Mr. Manoj Vallikkat. Mr. Manoj Vallikkat is from the Healthcare Insights team at IDC. He is a research in the healthcare digital health domain. He comes with over 15 years of experience across different countries, including India, Asia Pacific, Middle East. So, Manoj, welcome to the call. Welcome to the conversation.
Thank you very much, Sandeep. Thank you for having me here. It's my pleasure.
Great. So, uh, today, Manoj, we are going to discuss about uh, how the healthcare landscape in India is. And we all know that just a week back, the budget was passed in India. And we wanted to discuss the impact of that particular budget on the healthcare situation in India, on the healthcare landscape in India. So let's start with that. And the first question that I have for you is before we get on to the impact of the budget on the healthcare situation in India, let's first of all understand how the healthcare landscape is actually. So could you help us understand, some brief overview about the healthcare landscape and what are some of the challenges that the healthcare industry is facing in India?
Thank you, Sandeep. That's a good start, to discuss on the healthcare landscape before we really moving on to the core, core part of the budget, implications of the budget. My preference would be, just before touching upon the healthcare landscape and before really moving on with the underlying factors of the healthcare industry in India, I just want to quickly touch upon how boldly, the Indian healthcare sector has faced the COVID-19 outbreak. And we all know 2020 was that was a scenario the entire world has undergone. And it was indeed a test of resiliency for the healthcare sector, particularly healthcare sector. And of course, happy to say that the sector has survived that particular crisis, definitely through increased digital adoption. For example, the tools like telemedicine, robotics, artificial intelligence, strongly supported by healthcare policies or government policies, startup ecosystem, and as well as public-private partnerships. So one more point I just want to highlight at this point is COVID-19 was definitely not an initiator, but it was definitely an accelerator for digital adoption. So with that, the positive note, let me just get onto the nitty-gritties of, let me take a step back to understand the underlying factors and what is really the healthcare landscape of the Indian sector.
Sure. Manoj, let me
Yeah.
just point out to you that you've rightfully mentioned that COVID was an accelerator to many industries, including healthcare. And when you respond to my question about the challenges, please mention the additional challenges that the healthcare landscape in India had to face because of COVID as well, because that put a lot of stress on the Indian healthcare system. Yeah. Okay.
That's a good point. Yeah, definitely. Yeah.
Great.
So, when we try to understand the underlying factors of the healthcare industry, India is the second populous country in the world, and in 67% of the population is still living in rural areas in India. And the sector is under pressure. Healthcare sector is definitely under pressure, particularly because of poor infrastructure as well as the weak connectivity of the entire system. If we try to understand the, defining the landscape, let me just take it to different perspectives. The first point is I want to touch upon is the poor doctor-patient ratio. India has got less than one doctor for 1,000 people. And it's much less. To be precise, it is 0.9 is to 1,000, which is much less than the OECD average of 3.3 is to 1,000. So that says it all. And even same scenario when we take the number of beds per 1,000 people, it's again less than 1, to be precise 0.6. And when we move on to another aspect, it's public spend on the healthcare in India. It's staggeringly low. It continued to be low for the past couple of years. Actually, it's just 1.3% of the GDP. When we take the overall one, I'm talking about the public health spend, but when we do the overall 3.6% of GDP, including private sector, but public sector 1.3%, which is again very less compared to the developing countries in the region and the rest of the world as well. So let me move on to the next factor, which is on digital patient data. I mean, we are on digital world now. Entire world is moving towards digital. But when we take the case of India, the adoption of electronic medical record, the percentage of adoption is still I would say it's in very nascent stage, which has to really go up when in moving ahead when we talk about digital health, and this EMR is the foundation. And presently, Indian healthcare system has to improve a lot on that because it's in the very initial stage. And to make the situation more worse, and the country is facing a huge issues with increasing number of NCDs or non-communicable diseases. Yeah, and it's nothing but chronic diseases. And top chronic diseases are the cardiac related issues, cancer, even diabetes. So addressing this segment is still way behind. A lot to be done. Again, when I say a lot to be done, there is the traditional healthcare system as it's met its limits in reaching the care to them. For example, when I just try to highlight, cardiac care needs a quick response. Quick response is required. And in the case of cancer, it's what we need is a early detection and more kind of preventive measures. When we take the case of diabetes, it's a kind of continuous monitoring of the patients, right? So all the three segments of the chronic diseases needs different types of approach, which only digital health need to be taken care. So this again is at a lower level, which lot to be done on that. And then finally, when we come to the the health spend in the country, it's still 70% is on out-of-pocket expense. So lot again to be done on that actually. Though universal health package, universal healthcare is at its minimum, its initial stage. It's a continuous process, long-term process, but at least good that the process is started. It'll take a couple of years to achieve the limit of what we expect. So what I'm trying to stress at this point is weak infrastructure in healthcare segment means the lack of accessibility of care and non-affordability of care, which is very serious for the country. And one positive aspects when we try to look at is in 2020, Government of India announced NDH, National Digital Health Mission, which is being operated under National Health Authority. And I personally found it very, very attractive, mainly to address to bring up the EMR adoption in the country, because NDH is mainly targeting at bringing unique digital health ID to every citizen. And the ultimate purpose is, to convert all the, related healthcare records, digitize the healthcare records and put it in DigiLocker kind of stuff. So, the advantage is doctors and hospitals, irrespective of their location, they can access the patient's record at any one point of time. Lab tests need not be repeated again and again because it's already there in the locker. It's already there in the the digital platform. So NDHM's mission is that. So I'm finding a lot of hope to bring up the healthcare system, to bring up the digital platform with this NDHM. So digital health is moving forward. Digital health is the solution to address all the things, what areas and constraints and that I have already addressed from multiple perspectives. So a word of caution, a word of what we need to keep in mind is we need to be data rich for decision rich, right? I mean, it's a very well addressed, well known statement. And then for what is to be done to be data rich? It's by being data literate at all levels. So that says it all actually. So that's how the countries need to move ahead, and that is a path ahead for the Indian healthcare sector.
Sure. So did you see any of these issues being tackled in the budget this time? This was presented just a week back. So what are your
That's
observations?
yes. So I am okay. In single sentence answer, I would say yes, very clear yes. uh, of course, not 100%, but definitely the directions towards that. So I'm really happy to say
So we are
that
moving in
actually.
the right direction.
We are moving in the right direction.
Okay.
It's a clear statement. Let me again taking a step back. What I want to say is when we talk about a country's budget, it's not how much is the amount allocation, but and I give more importance to where the budget allocations are, and how that allocations are being deployed efficiently. Is it really reaching the right slots, which is already targeted? That's very important. So there are two aspects. So where? So answering to the where, Indian budget, healthcare budget in 2021, I would say it's fell in the right slot. It's a very positive statement because I got personally excited because the budget has got 6 pillars. Indian have the budget. Out of 6 pillars, the priority pillar is given to the preventive care and wellness. So that's very important. That's the number one pillar for the government. So why I said yes is the priority given by the government to healthcare sector. They have taken it as a top priority. So we are finding a lot of hope, and I strongly wish and expect that this will be rightly deployed. For example, the budget amount which is targeted at different slots, which I'm going to talk about now, will definitely fall into the right slot.
No, just one quick question here. I'm so
Yeah,
sorry, but just one quick question. Don't you think that you have worked in many Western countries as well? You have worked in Middle Eastern countries. You have a vast experience with the Asia Pacific region as well. In your opinion, just for the students to know, don't you think that preventive healthcare will reduce a lot of the disease burden and a lot of costs on the part of the public spending? Maybe that is why there is
very
a lot of focus on preventive healthcare.
exactly.
Okay.
See, preventive healthcare. The power of preventive healthcare is it will reduce the healthcare expense. It's very, very well known factor because, as I said earlier, we talk about mainly when we talk about preventive care, healthcare, it can be more addressed to the cancer care. Of course, we can relate it to any other aspects, for example, even cardiac care as well. But, let me take more focus on the cancer, because cancer is something which the solution is prevention, not the solution. For example, if a patient moves on to third stage, fourth stage, there is no escape, very tough. Coming back to normal life, coming back to that kind of situation, very tough. And imagine the treatment cost that person will have to undergo during the process, and then the expenses as well, and even the life, a painful life. So why all these things? So there is a huge amount of promotion. Even when we talk about a lot of doctors, experienced doctors, we hear them telling that prevention is much better. So so there are two aspects. One is definitely the cost saving, and a kind of quality life. I'm putting into the quality part, a painless, pain-free life, easy life. That's very important. Recently, Dr. Devi Shetty, in one of his address, what he was mentioning is it doesn't matter, when you're okay, I'm walking every day 1 hour, I'm doing exercise every day, half an hour to 1 hour. But the question is, that's very, very essential. But along with that, you must have health checkup as well. That's why he says that is mainly when he talks about prevention. Is there any kind of occurrence? Simple things, for example, arthritis, osteoarthritis, knee pain, a joint wear out, okay, the cartilage wear out. This can be analyzed 3 years prior, right? So yeah, I'm just moving away from the cancer, but, and any other cardiac issues can be analyzed according to Dr. Devi Shetty 10 years prior. So that's the advantage of preventive care. So imagine how many lives can be saved and how much cost can be saved when we talk
Right.
about when we bring in the preventive care. So that is where the Indian budget in 2021 has given the topmost priority for preventive care and wellness. So is it not exciting for all of us?
Yes, it
Yeah,
is.
right. Because yeah, it is. Yeah. So that's the same excitement. I just want to bring out actually how the the visionary, I would say, actually,
Sure.
because handling the population health. We got to talk about population health. We have to move from the government's perspective. They have to talk about population health. So preventive care is the word which they have to address it. And again, uh, we bring in a national digital health mission, what I said earlier.
Hmm.
What they're planning to get is all the patient data, on a common platform. Not as of now on a common platform, which will be in an isolated platform, separate platforms. But at least, patient data is getting created. But I am very confident that in future, it's going to be a common platform.
Yeah.
What's the advantage of common platform? It's lead to data analysis, and then lead to a kind of, what are the diseases, which is really focusing on particular region of the country, and
Sure.
what are the actions to be taken. Yeah. So these are the areas government is moving ahead, from their strategic aspects. So that's the thing. So preventive care is the segment which is on top priority, and then moving on to other areas, Sandeep. Uh, they have also touched upon upliftment of healthcare infrastructure, and that too in tier 2 and tier 3 cities. So is it not addressing our earlier constraint, which we have already said that, there is accessibility, lack of accessibility, non-affordability kind of stuff. So that's the second point which they are bringing it up.
Absolutely.
Uh, yeah. Third point is on drinking water. Okay, when we sit in city and then we talk about drinking water, we may not be feeling that much impact. But according to World Health Organization, it very clearly emphasized that water and sanitation are crucial things, aspects for basic healthcare,
Okay.
right? So the third point of Indian budget is for their really fund allocations for ensuring drinking water and sanitation, right?
So being in Bangalore and Chennai, I mean, I've lived in both the cities, so I can really understand the pain. Uh, we need
Exactly.
not go to a rural or a semi-urban area for that. Okay.
That's good to hear that actually. So that's another area which is really coming up on specific target of funding.
Okay.
And fourth segment is they are focusing on COVID-19 vaccine.
Mm-hmm.
India has really gone ahead in the vaccine development, vaccine distribution, those kind of areas. And then they're by the specific funding in 2021 budget, what I am finding is, I think pharma companies, this will give a boost to the pharma companies for new innovation, new innovative aspects. And another area could be to how effectively they can bring down the pricing, right? So yeah, so ultimately again, it will be beneficial for the society, for the population. So these are the four segments, for main focus areas of this Indian budget.
Great.
Now, when I come to the money part, and what I want to stress on is they have put 2.32 lakh crore budget allocation for this, which is 137% higher compared to the last year. So this is again a positive aspect, which, what I would say, government has heard the demand of the healthcare leaders that, there need to be increased spend on healthcare. So the 1.3% of public spend, 1.3% of GDP is tend to go up with this kind of spending on healthcare. And, I'm so sure that in coming years, it's really going to be two times to three times. And, Indian healthcare spend, I'm sure, will definitely go up and would be at par with the other developing countries in the next couple of years' time.
That's great to hear.
So, yeah.
So you've talked,
And
yeah, please go on.
sure. And okay, this is on one part of the budget, and something, but there is another new scheme which they have brought out with. I mean, they have rightly named it as Atmanirbhar Swasth Bharat Yojana. Okay, what they are going to focus on this is to focus on primary care, secondary care, and tertiary care. Right. So in India, 70% of the care delivery services are still with the private sector. Right. So there are big private hospital chains, and there are individuals, private hospitals. 70% is under their control, or tertiary hospital, a secondary hospital, tertiary hospital, and all that. Even though there are a lot of government hospitals, but it is suffering from lack of facilities. And most of the government hospitals, government facilities inside when we go to rural areas are morely restricted to primary health center. So they are going to really touching that particular aspect to bring in the extending primary, uplifting primary, secondary, and tertiary care, and at the same time uplifting the primary health center and sub-primary health center to health and wellness centers in rural and urban areas. So this is one area. This is very attractive, which is again what I'm trying to link is the link with the constraints, and then how effectively that budget is addressing those constraints. Earlier I talked about there are poor infrastructure, poor connectivity, non-affordability, non-accessibility. I can find if properly implemented, that non-accessibility part is really taken care of. Because leaving alone telemedicine, of course, we talk about telemedicine now, more particularly in 2020. In leaving alone telemedicine, even if there are no connectivity in the rural areas, but there are uplifted health and wellness center nearby. Patients are not away from the hospital, not away from the treatment, and that too, at an affordable kind of treatment. So these are the areas, major areas, which is addressed in the budget. I have already talked about the vaccination part already. And now let me just try to connect with the NDHM. Okay, budget is on one side, which I talked about NDHM earlier, which has happened in 2020. I'm just trying to connect the dots. When I try to connect the dots, all these measures, when really properly implemented, and then, trying to connect with this unique health ID of the patient, and then convert these, the treatment data, patient health records and lab records, everything on digitized, and then coming onto a platform. Don't you think it's giving us a great power for the country to move ahead? Particularly, I'm talking about on a digital platform, because as I said earlier, moving digital health is moving forward purely digital health, right?
Yeah,
so
absolutely.
All these factors, when I'm trying to connect the dots, the Indian budget 2021 is effectively merging with the NDHM's strategy, and then it's going to be a highly promising aspect for the country to move ahead.
If the NDHM becomes successfully implemented, then I think this is going to be a major catalyst for a lot of health interventions and programs in the country. You can, look at what happened to UID when it was being talked about. And after the rollout, just look at how UID has been leveraged across different government programs. So I think the NDHM it also holds a similar promise, provided the
Absolutely.
government needs to take it very seriously.
Rightly said. Rightly said.
Okay.
See, one is rightly you address the right point. Government's seriousness. The government drive is very essential. Government mandate is very essential. Particularly when we take the case of in Singapore, there's a clear mandate. Irrespective of the hospital size, irrespective of the number of beds, they have to convert patient records to digital. So that kind of mandate can come in India as well. And then second thing is incentivization. For example, government can incentivize, healthcare providers. Okay, you follow this, we will give you so much support from our side. So that's a kind of, encouraging
Sure.
Healthcare organizations to adopt, digital. So
Okay.
yes, right.
So Manoj, we have talked about how the budget has brought about a wave of positivity. Were there some things in the budget that you wanted to see, but you felt that the budget somehow missed? What are some of the areas of improvement in the budget that you would like to see incorporated in the healthcare industry in India?
Good point. Good point. You see, you would have noticed, Sandeep, throughout my conversation, I brought in a lot of digital aspects,
Yes.
right? So what I'm finding is that digital aspect is lacking in the budget. Okay. So I'm not blaming that budget, but it is in the right direction. And I also personally, I know, being in healthcare field, personally, I know that there is digital inherent in that. Okay. So because when we talk about, okay, we talked about budget, talked about preventive care, right? So I personally know preventive care automatically brings in data and AI into the picture. That it cannot survive otherwise. When we talk about wellness, automatically IoT and the connectivity bring into the picture. And then the one we talk about upliftment of the healthcare facilities, connectivity automatically comes, the telemedicine facilities comes, all those things comes.
Sure.
So it's inherent actually. But what I wish from my side is government can project the digital aspect. What is it for? Mainly that if government brings the digital aspect, that gives a motivation, encouragement for the organizations, healthcare organizations. Yes, government is stressing on digital, right? So it's a kind of awareness, it's a kind of motivation for them to at least turn towards digital aspect. So more specifically, Sandeep, they can talk about kind of digital platform, cloud platform. This is the kind of investment which we would like to plan, kind of stuff. So that will be a kind of motivation, a kind of stress, or to further invest from the organization side also to focus on digital aspects. So that's one thing I would like to project. Second point could be, I wish that we talked about cancer in detail. Actually, we talked about as part of NCDs and how cancer care need to be taken care. In 2020 alone, there are 14 lakhs new cancer patients in the country, right? And yeah, and we also know that the of course the preventive care is taking care, but some more else things to be done. When we analyze the entire world, I mean, the trend of the world, what's really happening, there are efforts towards, targeted medicine for cancer treatment. Because nowadays, widely what is being happening is a generic kind of treatment. We talk about chemotherapy, we talk about, radiation, oncology and all that. These are all a bit generic. Of course, there are effectiveness, but there are cases where, it recur. Another question from the patient side is why it recur, even after my treatment, right? So this is where the entire world, I mean, many of the such studies are still in pilot stage across the world, but efforts are on, particularly when we're talking about genome sequencing, right? So mainly for cancer, so cancer treatment. So that one area which government can focus on, probably in the coming year and in the budget. Some fund can be allotted. So I personally feel that is something which is very essential at this point. Then another point could be a home care, right? So we after passing through the 2020 that struggling phase, and people have they themselves got transformed to a kind of online aspects, and telemedicine, for example, if you take one specific hospital chain, it has gone from 4% to 80% is adoption, right? So that's a kind of online consulting happens. So it's more towards a hospital centric earlier to patient centric, right? So what I'm feeling is in coming years, there'll be more being patient centric. There'll be more home care requirement, home healthcare requirement need to be addressed. For example, people would not, at one point, people don't, even if you ask me, unlike earlier, I don't want to go to the hospital all the way, wait there for 1 or 2 hours and meet the doctor. If I can get consulting just by click of a button. So that's the scenario which we have to expect actually. I'm talking about telemedicine, but home care, even if, people have undergone surgery, they don't want to continue with the hospital. I want to shift my home. Maybe a kind of, ICU setup at home. My, continuous remote care, kind of connectivity with my doctor. So that's a kind of care delivery system which we need to expect. So government can focus on that area as well.
So this is both preclinical as well as post-clinical. Once you're
exactly
before you have gone to the hospital, is there any intervention that can be done at home? Once you have consulted and let's say you have been admitted, once you come back home, you don't need to go back regularly to the hospital. There can be digital health related interventions that can monitor the patients at home while you're at home. And all of this is also relevant, Manoj, I think, for the old age population. in our country, we do not have that significant population, but as far as that particular age segment is concerned. But if you look at some countries in the European Union, if you look at Japan, I mean, all of these, I've personally, I have seen a lot of startups in France when I was doing my MBA. A lot of companies were focusing on this particular factor, how to deliver healthcare at your home, at your doorstep, especially for this particular segment. I mean, yeah, there are lots of opportunities there as well.
Very good point. You brought in the right aspect, Sandeep, one that old elderly care.
Hmm.
Even India, as of now, we have nothing to worry as because we are not an age country like Japan but United Nations have already warned that India will become an age country. For example, 19% of the Indian population will be above 60 years by 2050.
By 2050.
Right? 2050.
Okay.
More years to we have long time. No issues to worry about. But it's better, we start thinking about taking care of elderly and then how effectively their life can be made easier.
Hmm.
So
Okay.
it's time government from the government level. I mean, not from the care provider and all that, but from government level, they can start thinking, how
Hmm.
effectively we
Hmm.
can take care of the elderly people. Yeah.
Sure.
So that's something which is,
Great.
and last and final point is on skilling part, something
Hmm.
which, all the above said areas will go flawlessly, seamlessly, provided, there is a clear investment on upskilling.
Okay.
Particularly, we all talk about, data analysis, artificial intelligence tools and algorithms, and we talk about IoTs and all that, so stream continuous connectivity. Everything need to be, upskilling is a very very top priority. Even when we start hearing from the healthcare providers, they all talk about upskilling,
Yeah.
right?
True.
Upskilling and reskilling. So this has to be a part of the budgeting as well. So
Sure.
these are the specific 4 areas I need to just project could have been better if these points are included.
Maybe in the next budget for sure.
Exactly. That's right.
Okay. So great, Manoj. Thank you so much for your time. And I always feel that it's a wonder when someone can literally condense, content worth, let's say, about 3-4 hours into half an hour. So that's
That's
really
right.
an amazing feat. And thank you for that. Thank you for summarizing the landscape of the country, the challenges that it faces, and some steps that the budget and the government have taken in the right spirit for a positive change in the industry today. I would just like to conclude, having taken note of all the points that you mentioned. The relevance of all these points for business school students is basically to become situationally aware that this is the landscape in the country right now. And I would also like to urge the business school students to make use of this situational awareness that has been presented in this conversation and build upon this and see if there are any entrepreneurship opportunities available. I am a strong believer of entrepreneurship and always feel that business school students, they are at a slightly lower level of risk as compared to other professions like us. So maybe this is the right time for them to also explore some of these opportunities. And the healthcare industry is actually ripe for entrepreneurship, and business school students must look at
Rightly.
that from different areas
Well,
such as preventive healthcare to, let's say, data related, data driven healthcare to different other different aspects of digital health, for example, connected health. I mean, there are amazing opportunities in healthcare. Your one final sentence of conclusion on that, Manoj.
yeah, yeah, okay. That's a great. I mean, I'm really excited to hear about the target audience, like MBA students. They are really entering to the world of opportunities,
Yeah,
actually.
absolutely.
So my just one key point is embrace digital because irrespective of any sector they are going to be in the future. I mean, digital can be a critical integral part of the process because we are entering to a kind of connected world irrespective of any, particularly on healthcare. We already addressed that. So whenever you are addressing, as Sandeep rightly mentioned, entrepreneurship, India has got a lot of opportunities, and then it's an era of startups. We have very very successful startups in front of us. which is really helping the society actually. So
Yeah.
in multiple ways. And just one point is, whenever you are at this in the tech, I mean, don't simply go by the just for the sake of technology adoption, going by the technology. It should not be. It should be of solving business problems. So business problems should be the top priority, and then let technology take care of that part.
Sure.
And then you also realize that in future world is going to be outcome based, right? It future world will give a lot of importance to values rather than services.
Mm.
It's not simply services. It's the question is, what is that value you're adding to your consumer? That's
Sure.
very important.
Sure.
So this is my just final concluding words to you. When you're just have your outlook in that aspect. Fee
Mm.
for service era is gone. The new era is fee for value. So what's the value you're adding to the end consumer? That's very important.
That
Thank you.
is actually great, and those are very stimulating thoughts, Manoj. Thank you for that. Thank you for taking our time today, and I hope that this conversation will become some food for thought for business school students in the country. Thank you so much, Manoj, for taking out time. It has been a pleasure interacting with you as always. Thank you.
Thank you very much, Sandeep. My pleasure to
Have
be
a
a
nice
part
day.
of this.
Have a nice day.
Thank you.
Thank you,
Bye.
everyone. Bye.
Bye. Bye.